it's actually kind of sad due to the weather. I mean, I'm actually surprised there's only one weather casualty that we've had. Lorraine Chapman from was it Macadamian? Yes. Is unable to attend. They canceled her flight, and we're bummed not to have her. But we have an incredible group today, and this next session is called Stickiness and Results: The $1 Million Quest. And we know that long-term engagement, long-term use is kind of like been the key word for a long time. How are we getting people to engage in extended ways, and not only engage at the beginning and adopt it, but then permanently, thank you very much, perfect, but then really integrate technology and really integrate tracking or whatever it may be into their lives. So this next session is here to tackle it. So I'm going to introduce you to our moderator, Tom Dusenberry. He's the CEO and founder of Dusenberry Entertainment. And his motto is, it's all about the fun. So I'm going to let you take it from there.
Thank you. Good afternoon, everyone. It's a pleasure to be here. The panel and I are going to talk about stickiness today. And, from a game guy's point of view, why am I in the health business? And the answer is that games are all about stickiness. And so we're going to relate a lot of that to our panel discussion today. Dusenberry Entertainment has been in business for 13 years. And over the last 7 years, I've focused on games and health. And I focus on the sensor side of the business as well as the engagement side of the business. So I've got some experience in this area that I'd like to share with you today. Next slide, please. Okay, super. So I've spent 30 years in the game business, primarily in interactive entertainment. You might know some of the companies I worked at, such as Parker Brother Games, which is Monopoly, Trivial Pursuit, Nerf, and many of those great games. And in 1991, I was given the opportunity to found and create my own company called Hasbro Interactive, which was focused on digital entertainment. And during that period of time, I built not only Hasbro Interactive as a big video game company, but we also went into the digital world and we created games.com and created a major happening in that market as well. During my time at Hasbro, I was able to purchase many different companies, including Atari. So I was actually the CEO of Atari during a certain period of my time as well. And today, our panelists really consist of Catherine, as well as Mary Kay and Felicia, and we're going to speak about different aspects of the digital health and how we can really, address the stickiness type issue. So this slide didn't come out, but the slide I was just going to try to make is that in the digital area, there's over 1 million apps that are in the marketplace. And those apps represent just about $25 billion worth of business at this point. What's interesting is 72% of the revenue that's being generated in the app business is being generated by games. So games are very critical if you want to make money as it relates to trying to tie in money and the engagement opportunity. So one of the areas that I focus on is called gamification. And gamification really is the coming together of different types of activities that create an engagement tool for your consumer. So really that's what we're trying to do, is create that deeper engagement for the community. And what we do is we're different than most other gamification companies from a point of view that we use both games and gamification tools to make that engagement experience happen. So, we use classic games such as trivial games and crossword games and things like that. But equally important, we use leaderboards, incentive programs, and rewards. So we're really, trying to create that digital health engagement opportunity. One of the companies that I work with at Dusenberry Entertainment is called Game Metric Solutions. It's 100% focused on health and wellness. And what's interesting about this company is that we actually use games and game mechanics to create that engagement. And really, there's 3 components of our business. The first is a plug-and-play solution where we come in and work with you, and we're able to integrate right into your website games and game mechanics. So there's a seamless experience from your patient's point of view, but there's a hard difference between where you are and where we are from a point of view of what's happening with data and that type of stuff. The second thing is games, because of the fact that people come back and play them over and over, and they want to play them for a long period of time, create that stickiness. And so that's what that consumer engagement's all about. And then the third thing, of course, is reporting and analytics. And we've got a robust back-end solution that's able to give information to our partners as it relates to what's happening with patient care. So with that, I'd like to start the panel, and maybe we can start with you, and you can make an introduction of your company.
Great. Thank you very much. It's a pleasure to be here. I have a few slides if they're available. I'm Catherine Calarco. I'm the Chief Marketing Officer for HeartMath. Many of you may have know about us. And how many of you out there are feeling a little stressed or would like a little relief? Anybody have any trouble getting here? Or so, not at all, no. When anybody, really what we are about is helping you to use the power of your own body to create and manage your emotional response to stress. So we work with millions of companies, millions of people across 85 countries. We have about 300,000 technologies in the field, and people have been using them for at least more than 2 years on a regular basis. So we understand the stickiness and the creation of a community and understand a little bit in a different way. We believe in gamification. We think it's phenomenal. And Tom has known about HeartMath for a very long time. So we are the leaders in heart rate variability. It's a new biometric that you'll be hearing a bit about. And also we are about taking that HRV and doing something with it. So we create an intervention that actually delivers outcomes using heart rate variability and a coherent state, which is a synchronization of your heart and your brain. So really it is about being your best self and creating a better world from that. So people are stressed. What we understand in connecting with customers is that emotion is the most powerful driver of behavior change. And in the end, it all does come down to how you manage your emotions. And it is an anchor for that behavior change is what the Inner Balance app and our M-Wave technologies do for people. We feel it's very important for people to be purposeful. Why are you doing this? What is the outcomes you're trying to achieve? Recently, Esther Dyson said, we don't need more apps, we need more companies that deliver outcomes. So really what we're looking for is how can we facilitate that as a community to really create better healthcare and a better world. And I think really what's important is understanding each other. I think everyone is different, and I think it's important to understand who your customers are and what you're trying to deliver for them and make it easy for them to adopt. Make it simple, make it effective, and don't try to do everything in the first revision. You have a journey, so you want to take them on that journey that delivers results. And we have over 20 years of research and scientific validation of our products, our technologies, and our trainings. And we see a more than 60% reduction in stress. Again and again and again. So I think that's very important. And we also feel it's important to celebrate success, really understand the benefit you're giving and actually have that celebration occur within the community, with awards, with gamification, with actually the fun fact. And I think most importantly, you have to deliver results. And those results need to be personal to the individual. And I think a lot of it comes from great partnerships, and like these people on the stage today. So we want to know how we can help you. We would love to engage with more people in this community so that we all succeed in changing healthcare and changing people's lives and therefore the world. So thank you very much.
Thank you. Mary Kay?
I won't need this because I actually don't have slides. I'm Mary Kay Foley. I'm the Vice President of User Experience at athenahealth. You may have met my colleague this morning, Abby John. She's the Vice President of User Experience at Hippocrates, and we work very closely together. On the athenahealth side, we are a cloud-based provider of services in sort of sometimes I think of it as the rest of what goes on, the things, the medical practice. This is the doctor, the nurse practitioner, the nurse, the MA, the biller, the practice manager. We reach out to insurers. We reach to the patient through that whole ensemble cast, which gives me a slightly different take on how to get patients moving healthy, getting them healthier and healthier. I myself have been in the user experience business for over 25 years at a variety of companies across a number of different industries, both addressing business-to-business needs, consumer needs, and if anything, I have a little bit of a specialty in either creating or reviving user experience, human-centered design capabilities. So I've gone to a number of different industries, but I've been at athenahealth for 5 years now, and I've got to say I'm hooked because the challenges that we're addressing, that you're addressing, are just so important, so meaningful, and let's face it, healthcare in some ways, healthcare IT is the land that time forgot. They need us. So I'm hooked. I'm in it for the long run. And in particular, I'm interested in how we transform from a very data clerk-centric kind of approach, which happens in a lot of medical practices and hospitals. You deal with government regulations, over to something that's truly beautiful, which we define as a simple, elegant expression of purpose. And Catherine, you were just talking about purpose. It's not enough, I feel, to just be simple. It's not enough just to be elegant. That's always great, but you've got to drive the purpose. And the purpose is making us all healthier in a more effective way, lower cost, and I wouldn't mind being happier and less stressed as well. So I'd love to talk about how all those different players and those different users connect together to drive us to better health.
Thank you. I can have my slides. Hi, everyone. This is Vaishali Kamat from Cambridge Consultants. Does everyone know Cambridge Consultants? Of course you do, right? How many people think it's Cambridge from Cambridge, Massachusetts? No, Cambridge, England. I'm on an 8-hour time difference, so you'll have to excuse me. So Cambridge Consultants is a product development and technology consulting firm, and I was lying. It actually is in Cambridge, Massachusetts as well, but the original company is from Cambridge, England, out of Cambridge University. And we've recently opened an office in Singapore as well to serve the Asian market. What is it that we do? We do product development, so it's engineering. I come from a device background. The company does device development and technology development for a large variety of clients. Focus in 3 major sectors. Medical technology, which is where I come from, is about 40% of the business, and there we really see the entire gamut of devices that you can imagine for different applications. So on the screen there you see drug delivery applications, so inhalers, injection devices, things like that. Diagnostics, so over-the-counter as well as lab instruments, and surgical and implantable devices as well. The second sector we are very active in is consumer products. And so hence at CES, you see everything from FMCG and fast-moving electronics to household appliances, industrial, and transport as well. And then the final one, which is a technology focus, is a very large wireless division. In fact, I think we have the world's largest independent wireless technology development team, which does everything from the air traffic control radar, which you see that box, the slightly ugly-looking box at the bottom, to satellite telecoms, to mobile telecoms, cell phones and the like, to wireless medical devices for healthcare. What all of that does is gives us a breadth of experience in various sectors, allows us to cross-fertilize all of the technology, the know-how, the insight into the market, and bring together solutions for digital health, really spanning the entire spectrum. So I'm really excited to be in this sort of space with Cambridge Consultants because that gives me the ability to not only develop preventive care and wellness devices for the consumer market, but also regulated medical devices for clinical care to improve outcomes for various disease conditions. So it's quite exciting to be here and looking forward to the discussion. Thank you.
Thank you. So as a panel, we sat down and we talked and we said, what do we really want you to get out of this? And we thought that what would be appropriate is to try to give you some examples of where stickiness really does work in the marketplace. So I'd like to start with that question with the panel. And the question would be is how do you define stickiness and what does that really mean? And I find it interesting because when we talk about stickiness in the digital health area, there's got to be some type of timeline associated with it. And I find that like with Weight Watchers, what they find is that they have a stickiness period with their clientele for about a 6-month period of time and then it drops off. So from a digital health perspective, if we're creating this stickiness type of experience, what is it and how long should it last and what should be the expectation from the audience's point of view? You want to start?
Sure. We find that with our technology, people, when they first get it, the big thing is getting them to take it out of the box. So once they get it out of the box, they, in combination with the training that goes with the technology, they use it regularly for about 1 to 6 months. And then they drop it for a little while. And then something happens in their life. And they go, oh gosh, I got to get that M wave or that inner balance thing again. What was that about? And they pick it up again and they don't drop it for more than 2 years. So they use it on over 85% of our customer base. When they start using the technology, that's the pattern that we see. And we see that because it becomes a regular routine, like meditation or exercise, or it becomes part of their daily life, and they don't not learn it. So once they take the advantage of the technology, they learn a new way of being, and that's like riding a bike. So it becomes part of the way they operate. Mm-hmm. So I think enabling the technology to create that effect, we've seen great results for 2+ years where people are still using it on a weekly to daily basis.
And speaking as a consumer, that's exactly what happened to me. Is I lasted about 4 or 5 months and I kind of let it go, but now I can't really have a phone call without putting my sensor on it to find out what my stress level is.
Yeah.
Reset yourself.
Well, so care through a medical practice or through a hospital is very intermittent, or at least you hope it's intermittent, right? You don't want to go into a hospital too often, although there are people who are there all the time. So our challenge is to try, our challenge on behalf of the doctors who provide the care is to get patients not just to nod when they've been to their appointment. Yes, I'll get up off the couch. Yes, I'll walk around the block. Yes, I'll de-stress. I'll eat right. I'll stop smoking. But to actually follow through on that. And as soon as they're out of that bubble, what are the kinds of things you could do? And I actually wanted to share some research that we did, which surprised us a little bit. We were, this is a couple of years ago, and we were digging into health trackers and reminders and so on using the phone. And we were talking to people who had relevant conditions. So these weren't, imagine you have a heart attack, or imagine you're trying to quit smoking, imagine you're diabetic. We went to people who had these problems. And we set up the scenario that said, what if you got a reminder? Is it hard to take your pills? Yes, it is. So, okay, for that subset, we said, how about a reminder? And they said, okay, that's nice, will be a reminder. Then we had this idea we were really excited about. How about, you guys are going to guess what it is. How about you take somebody in your family or a friend you trust and make them into your health nag? How would that work? And at first they say, just in the course of the research, oh yeah, I think that would help. Of course, I know how to get around my mother, And if I'm busy and the phone is chirping, I'll probably just pretend I took the pill. If that'll be faster. And we said, oh, that's it, we're crushed, right? But good scientists were sitting there with our clipboards and doing it. And then we had one last thing. We said, well, what if this information went to your doctor? It's going to my doctor? Oh, it's going to my doctor. Oh, I will definitely do that. Well, what would you do if you're too busy? I'd have to stop and take the pill. That connection, so we're talking about where to find that emotion, right? Friends, family, they're part of our circle, and sometimes we pay attention to them, and sometimes we don't. But it turns out if you have had a meaningful moment of care with a healthcare provider, that is an incredible piece of leverage. So when I first was thinking about, oh my gosh, the only way I can get to the patients is by crawling through the medical practice, right? That turns out to be the biggest lever for me, is getting the doctors to express themselves in a way where there are a lot of touch points, and annual checkups are annual, so that's well past your 6 month that we give them a set of, you can't do it every week, can't do it every month even, but every couple of months, like once a quarter, just a little reminder out there is what works. And that's been, I thought that was a really instructive experience.
Yeah, I think I agree. I think stickiness tends to be defined, or should be defined perhaps slightly differently depending on what the device is or what the solution is. So for example, I agree with Catherine, is if you tend to use something for a few months and then drop it and come back to it, and it becomes a state of being, you get used to it, then that kind of eases into your life and it doesn't need nagging. But in some cases where you really do need that constant feedback, and then you have to measure stickiness by how long can you sustain with or without feedback. And
Right.
so it really depends on what the solution is as to how we define stickiness, and how to incorporate it depends on, again, what is it? Is it something that you're doing for yourself? Is it something that you're doing for somebody you're caring for? And that again becomes a very different measure.
Yeah. Yeah, we did the same thing we launched our Heart Cloud, our new cloud functionality, and we have hundreds of thousands of sessions and points that are loading every day, and it's changing the behavior change of the stickiness, and it's actually creating more stickiness because it's actually that reminder, that competitive reminder or something like that. It's like and we work with 15,000 health professionals who refer a lot of clients to us. So there's that nice referral matrix that actually creates more of that stickiness. So it's both the cloud that's doing it and the referral from health professionals and then the actual product outcomes. So you're right, it's a multi-touch, value point. Yeah.
From a access point of view, there is the PC, there's the tablet, there's the mobile device, then there's independent devices as well. What is the access point from your customer's point of view, and what's the importance of mobile as it relates to being able to communicate at this stage?
Yeah, absolutely. We had to move into mobile. We've been in person, then we went computer, then we went handheld, and then we went mobile. And we were being pushed to go to mobile faster than we were able to deliver to that. And we've seen a phenomenal increase in adoption because of the fact that it's on the mobile platform. It's ubiquitous, so it's able to...
When I've interacted with the different medical people that I've been with, they all say that they need a medical solution. And then I ask, well, do you want apps? And they go, well, yeah. And I go, do you want the mobile app or the mobile web? And they go, well, yeah, we want that too. And they don't really define exactly what they want. And is there any way that we can get clarity as it relates to what they're really looking for?
Test.
Test.
I think we used to call it the rain conversation. I was talking about a kingdom and they're talking about the weather. So you have to, and often people would ask, well, I want integration. This is what I want. But in fact, you have to really ask a lot of questions and actually test to see what they actually use and follow others who are doing it well. I mean, there's a lot of people who have actually figured this out before us.
On your business, are you using for the tablet? Are you using HTML5 or are you using Flash?
HTML5.
HTML5.
Yeah.
Okay.
Yeah.
Great.
Absolutely.
I was going to go a step further, actually. Testing with users is great, but sometimes you don't know what you don't know.
Right.
And so, asking people what they would want is sometimes not the best way to go about it. You have to kind of glean it, the latent needs, and we do that all the time when we do human factor studies, you try and understand the environment of use, the unmet need, but not by directly asking. You have to glean that information
So you're
from other
using
things.
direct observation, ethnographic studies? Absolutely.
Exactly.
Absolutely. Once you really feel confident in your audience and you think you understand the problem, you absolutely want to move to remote techniques, add those in because they're so much cheaper and faster to do. But there is nothing that beats the direct observation. You can ask till the cows come home. If it's so routine or so accepted that it's invisible to them, they will never talk about it. So you must see it in person.
Great. We often talk about design and how important design is into our product and what our mission is. And I think we all define design in a different type of a way. So maybe we should explain what we mean as it relates to putting design into our product. And from my perspective, for the games background, it's all about the fun. And so that means that the designer is the most important person in the entire team because he delivers that fun experience, which brings people back over and over. And I think we should talk a little bit about that as it relates to your businesses as well.
Yeah, the design is about how do we integrate the learning, how do we translate training that we do, the in-person coaching, to an app and make it part of it without it being an extra step somebody has to do. So really the simplicity of the design was very important to us, and also yet the depth of outcomes. So that's a hard thing to do. It takes a long time to actually figure that out, and people are like, oh, how come it doesn't have this, and how come it doesn't have that? And I think you really have to decide what is the core that you want to deliver in that first user experience, and then what's the roadmap to further optimizing it. So the design aspect is really about being customer-centric or physician-centric and really understanding what is their flow that will actually make it work for them, and then making it aesthetic, so it's actually fun to use. Yeah.
I mean, I always think of the great Steve Jobs quote, design is not what it looks like or feels like, design is how it works. And if something's going to work and it's going to get to outcomes, you must understand the problem. And it is so easy. I work quite a bit right now. We're working on a reimagined electronic health record that really supports the moment of care between the physician and the patient. And the longer you think about this, delve into this problem, of course, we're lucky. We have an EHR, and so we have lots of data that we can turn to find out how people use it. But what was so striking to me was the moment I realized that for ages, people had thought of an electronic health record as an authoring tool. Because I saw that doctor, my doctor wrote on a piece of paper, therefore it must be about creating that artifact. And it's actually not. It's about applying, asking the right questions that we're just talking about, asking the right questions of the patient, listening to the patient, connecting the dots together, deciding if there's a diagnosis, and then coming up with a plan of care that you think the patient can. And the record, the written record, is just something that supports that. So what happens when you define the problem just a little bit off? You come out with something that turns doctors into data entry clerks. They're spending all this time with drop downs and filling things in. And what suffers is that care with the patient. Makes it harder to listen to the patient when they're trying to tell you something. Maybe they're embarrassed about it and so on. And it's added to the amount of data that's not as relevant. You talked about you have that moment, something happens. Mm-hmm. That makes it relevant. That makes it relevant. Something happens and it makes it relevant. Well, we're helping doctors and patients deal with what's relevant.
Mm-hmm. Now, in the devices world, we look at design from two different angles. So we've got the outward design, the industrial design, how an object looks or feels or how it's handled, how it's used properly because it's got the right kind of features and it fits in the palm of your hand or it sits on your desktop and has eye-level menus, all those kinds of things, which is the outward piece. But then you're also looking at design from a technical, from an implementation standpoint, the engineering of it. So all of the architecture, what technology needs to go in it, how big is it going to be, what is it going to cost? And the two have to marry, because you can't actually have a fantastic industrial design and then have the technology not fit in whatever you imagined. And so what we do is definitely looking at both of those in parallel throughout the development process, where you have to then bring to life the vision that you had when you started out after the technology is implemented and manufactured. And so you look at it throughout the entire development cycle, and you're absolutely right, is what is relevant, what is important, or you don't push technology just for the sake of it, but because it's meaningful, because it's useful, and it leads to an outcome.
Great. So two of our panelists have devices associated with their product. And to drill down a little bit deeper on the design side, when a consumer buys your product, they have an out-of-the-box experience. And what is that out-of-the-box experience, and what do you expect from them in like the first hour? And what kind of hurdles do you have to deal with and then overcome?
Should I take that first? Sure. So one of the interesting things our designers say is again, going back to the point, is they have to open the box. And so we start even before that. They have to go and get the box. In the case of the medical device or prescription, you actually have to go get it. And then once you've gotten it, the way the device is packaged, the way the instructions for use are set up, the way the kit is set up, it has to aid in the use. It has to make it simple and intuitive so that you're not afraid, you're not overwhelmed by what it is in front of you. In many cases, we're dealing with patients with conditions that hamper the dexterity, or they have certain other sort of factors that are affected. You want to make sure that you're addressing that audience in the device design, in the box design, in the instructions for use. And then once that step is reached, you've gotten to opening the box, then you have to have the device usage, and then the learning process that is associated with that, whether that's coming from the doctor, from yourself, or from a pharmacist. So we have to take into account all of those things when we're actually putting together the overall systems. It's not just about the device, but all of it that goes with it.
Do you have anything to add?
So yeah, I think you make it pretty and people download it and you don't have to open a box. So the box arrives, the experience is there, and then you get the sensor and you're dying to use it, so you connect it and try to find out what's going on. So I think that the mobile platform enables you to have that opening box experience without having to wait for the box to arrive. So I think that, and then you're so intrigued, you want to figure out how you do this, that you connect the sensor up. So I think that that is a big advantage to the mobile platform. And I also think it's another big advantage is how fast Amazon can get product to you nowadays. And if we can get, the other one is that there's a lot of health professionals and people who actually use it. And so you get that experience, that aha moment of, oh my gosh, I can actually change my physiology. This is amazing. I need this. So they wait in anticipation and want to open it when they actually get it. So I think it's the experience side of it before they actually get the box, and then making it easy for the box to be opened, and the interest in actually trying it out to be evident.
Great. So to switch gears here a little bit, let's talk a little bit about the channel and how we each define the channel. We were talking earlier and we kind of had a different definition. And for me with Game Metrics, when I'm pursuing the market, I'm going after the health media market. So Crane Staywell, McCann Health, those are really important channel partners from my perspective, but the panelists have different perspectives and we should hear where they come from. You want to start?
In terms of channel partners, I think that there's a couple of ways you can go. One of them is strategic in terms of we've worked very closely with Kaiser Permanente in Northern California, partnering with stress management programs within their hospital group to really help to create more of a caring environment, improve the stress of the caregivers, and create outcomes for the hospital. So in that sense, it's a tremendous impact. We also are partnering with a group up in Canada who are helping with the disaster relief, and they're training thousands of people on how to manage the emotional response to a disaster occurring. And that's a very large project, very innovative group that are really trying to actually make a difference in their community. And then we have other partners such as, they're a little more silent, but but more in the consumer channel markets, the Amazons, the e-tailers, the retailers who are actually doing a lot for us. And we work in partnership with them. And then we also have partners who are more on the licensing side, because we look to license our technology out and who we're partnering with. So it really depends on what area. And I think last year we announced the GPS for the Soul partnership with the Huffington Post, and actually worked quite collaboratively to integrate our technology with their app, and really provide a channel for our content through a media partner. So partners are very important to small companies. There's no way to scale without them, is my impression, and I think also it demonstrates the breadth of your solution without you having to do it in those different segments.
Excellent. Mary Kay?
Yeah. Well, first of all, I would say that we are a channel. We have our More Disruption Please program, where we love to get, and we have many best of breed applications that come into our marketplace. We've got our users, doctors, front desk people, patients, downloading those, adding them to their system, and we hold people to a high standard. If you don't help on the performance of the system, then you're put on probation and you've got to get better. And so we talk to them about how to understand their users better and how to understand their work better. So that's one thing. But for the rest of it, understanding the data that comes to a patient, we have to look at it in a slightly different way. Because a patient is going to get their care, going to get their flu shot where they work, maybe their kids get something, get their eyes checked at school. If you happen to go to a hospital that is running 1, 2, 20 EHRs that are competitors of ours, we can't care. We've got to just integrate with everybody because it all comes together in one patient. So I know that's slightly different from what you were asking, but I just want to double down on, for anybody who's working in this area, to always, we bite off one particular problem or one particular facet or a couple of these together, always being cognizant of the fact that we're going to be working together on this, and that's what pulls it together for patients.
Well, I'm in a slightly different boat in that Cambridge Consultants doesn't market its own products, so we develop products for our clients. And so our sort of view is to help clients find what the appropriate channel is for them. And it's very interesting, especially in the new space now with digital health and products as well as services becoming important, where different channels are appropriate. It's not just a product business. You have to look into recurring revenue and all those things. So we are helping clients figure out what is best, how to bring a new offer into the market, and what the best channel would be, or who the partners should be that they should work with as well.
Great. So maybe the last thing we talk about before we open up to questions in the audience is that, can we give an example of how our product works and how we can have an impact in the marketplace? And so for me, as an example, we were working with Crane Stainwell, and we were talking about working with the nurse practitioners. And they had put together an entire interactive guide talking about diabetes and how you address that issue with your patients. And they found that although the interactive guide was well put together, about 90% of the nurses weren't making it through the program. So they came to us and they said, hey, could you do something to modify this so that we could get the nurses through the program? And so we put together this construct where what we would do is we would ask, when you come into the website, we would say, hey, push this button right here and you can get a video from the executive director. The executive director would introduce you to the idea that maybe you could play a trivia game, and that would be another way for you to learn some of the information that was in the interactive guide. So the first thing we did before we asked you to sign in or anything else is we just asked you to play a game. So it was like a Jeopardy game. It had 25 questions with different levels and that type of stuff. And then once you get through that, we said, would you please sign in and participate in this program? So in the interactive guide with each of the different chapters, there was a little plug and play. You would hit the button and you would be able to go in and play some games and some information related to what that category was. And then once you got through the program, we said, to graduate and to get your diploma, we ask you one last thing, and that is, would you play this game? They play the very same game at the end as that they played at the beginning. The difference is at the beginning they might have gotten 7 or 8 right, and at the end they get 14 or 15 or 16 right, and we showed clear improvement as it relates to knowledge level. So there was an example of how we were able to put a construct into place and really help a customer.
Very good. Wow, awesome. We have over 80 research papers published on outcomes associated with our training and device. So where do I begin? I think what's really amazing is at CES, let's stay relevant to sort of us as a cohort here. At CES a year ago, a CEO of a small tech company in DC ran to the booth. And we're looking at him and he goes, HeartMath, you're here. And he says, you saved my life. And we looked at him like, oh my goodness. He said with his health professional, he was able to basically recognize he was having some cardiac issues. He recovered from that and has actually recovered completely. And he said, I use it every day, and this has really transformed my entire life. And we get that every day, and that is so rewarding. It's amazing the kind of impact we've had. We've also been able to transform the communities at several hospitals, and also recently, if you watch our leaderboard, there are 2 people who are competing to have the most points per day. And they are not HeartMath employees. And that has transformed their lives in terms of actually their physical abilities they're using their natural competitiveness to actually improve their health. So we've seen everything from people with PTSD and military to kids' test anxiety. So I think that there is no doubt that we're changing the world, and that's one of the reasons why we're in business. So we look for more examples and hope that we can help make our product even more sticky.
Yeah, if in terms of stickiness and moving expectation and moving the business, as you know, we all know there's so many regulations. ICD-10 is coming, meaningful use. Over and over again, what we hear now is we reach out into our community and do research. We try to find out from physicians in particular, how are you going to approach meaningful use stage 2? What are your biggest worries? Where do you want us to help you the most? And we get a fair number of responses that are, I don't have to pay attention to meaningful use stage 2 because you'll pay attention to it for me. I don't have to worry about ICD-10 because you've figured it out for me. I can pay attention to treating kids. I'm a pediatrician or so on. And that means an awful lot to me, getting the paperwork out of people's faces. Yeah.
Absolutely. Again, I'm going to defer to client projects here, which there are several of, and I'm not allowed to mention most of them. But suffice to say, over the last 50 years, Cambridge Consultants has put out a lot of different products onto the market for clients. And so that's sort of a good thing to be proud of. The one thing that I will mention is IP creation. So a lot of the times we will, smart engineers in-house develop some IP that gets spun out, and the biggest sort of thing that I can point to is most of your cell phones have Bluetooth, single-chip Bluetooth solutions. So back in the late 90s, IP developed in-house was spun out as Cambridge Silicon Radio, which now has the largest market share for single-chip Bluetooth chip solution. And so it's just things that we can be proud of and continue to develop for our clients as well.
Excellent. We're going to open up for questions now. And if there's anybody that's interested in any more information about my business or MMath, there's some information at the back table that you might want to pick up. questions?
HeartMath.
HeartMath, I'm sorry.
HeartMath at the back of the table.
Tom, question.
Get the lights on.
I don't know what percentage of the population it is, the small percentage that are gamophobic,
Gamophobic?
will not, do not, or get negative reinforcement from games. What is the impact of that small population in terms of your strategy, or do you just write them off?
Well, I think that there's a room for everybody, and I think you're bringing up a really important point. When I first started in this journey, we said that we were going to introduce games and gamification to the medical field, and most of the medical people said, we don't want Call of Duty and we don't want World of Warcraft in our business. It just isn't appropriate.
Right.
So we turned around and we said, well, we'll offer casual games. And then the medical people came back and said, well, anybody can do that. There's no intelligence to it. So that we really evolved to the point that we offer trivia games, crossword games, games that have intellect to it and some type of basis for information. And that seems to have really mitigated the issue as it relates to being able to use some fundamental games and gamification in that engagement opportunity. So I do think that there are certain people that don't want to play games, but the vast, vast, vast majority of people between the ages of 3 and 87 are playing games, and so you just want to try to incorporate that into your business.
Tom, do you have some game for people who may have more time? So, for example, the senior people or maybe the patient, to make them feel better, to enjoy their life.
I think games are really important for all kinds of different activities, like Alzheimer's as an example. There's all kinds of activities going on trying to use games to extend that business. And I think that you really have to pay attention to what the business mission is, how the game fits in, and then make sure that you do a really good job on the design side.
Yeah, absolutely.
And I find it interesting because most companies in the health business say, well, we'll just throw the engagement stuff to our IT people, and our IT people will figure it out. And the IT people come back and say, oh, hell, we can do a game, and we'll get it up and going for you. The reality is that games are no different than movies or books, and that is that although anybody can do it, there's very few people that can do it great. And I think that that's one of the points that I really would make is that if you're going to use games in your business, make sure you're using game designers that are using those mechanisms and those mechanics directly related to the audience that you're going for.
Completely. The senior market game or use of technology is completely different, and a lot of technology is not adapted for for what it needs to do. There's a couple of companies, Daykim is one of them. The Silver Summit is here, and there's a few good people that are actually in that area who've done some work, but really ask if they've got experience on creating things that are used in the senior market that people will adopt. AARP is pretty good at. They've actually got some fun things that they do on their website, but it is very different. And I'd like to see more, because there's a need for that, and we shouldn't wait for the next generation to get old for that to happen. So let's help them.
Hi, Terrence Finn from Remedy Health Media. I'm going to give you a little bit of a harder question. It's great to hear the successes that you've had and those experiences. What are some of the current challenges? What are the things that you're struggling with? Because I find I learn more from other people's struggles. So what are some of the things you're struggling with right now?
For me, I find the struggle to get the company to focus on engagement instead of focusing on all the things associated with engagement. And what I mean by that is that if you're going to use games as an example, use games to create that engagement, and don't worry so much about what the reporting and rewards and all those types of things are, because they will come with time once you get that first engagement established. And what I find in the medical field is that everybody worries about what the reporting is going to be and how we're going to do the analytics and that type of stuff, and they lose sight of what the real mission is, and that is the stickiness factor and making sure that you get that deep engagement with your patient.
Yeah, I agree with that. The whole focus thing, and also agreeing within the company what's the most important thing. So, and allowing the customer to be the center of that, is often difficult because a lot of people are attached to different aspects of the product, which you have to learn to manage within the organization. The other thing is we're bootstrapped. Really hard to scale as a bootstrap company, really hard. So and so you've got to invest, we're crossing that chasm of investing in technology while you have your legacy products, right? So so I think that it's really important to understand the financial dynamics of that and set realistic expectations on what your adoption rate is. We succeeded this year, which was pretty wow, but the reality is that we are not as large as we would like to be, and I think that is a constant challenge as a bootstrapped organization on how to actually achieve that exponential growth with hardware technology.
Yeah. I would say the hardest thing is that once you address one problem, you reveal the next. So you've just always got to be swimming forward. It's a complex space. You may be tempted to, and your clients may want you to look back and do things for what the problem was yesterday. But in fact, you've got to be brave enough to leapfrog that. I think about, we were talking about mobile and how personal that is. It's just changed the whole out-of-box experience. So you can't keep looking back. You've got to swim forward. I'll tell you what my biggest fear is in healthcare is hope and fear. We're changing to an outcome-based model, and we want to have transparency for cost. So patients, we can all see what things cost. But we know what happens to human beings when they get overloaded with information that they know is really, really important. They dither, they deny, they walk away from the problem. So there's all this motivation and control that can come from that transparency. It's going to be very hard to make sure that we actually unleash that and make sure that people aren't afraid and just running away from the problem.
I'm going to answer in one sentence, which is the challenge currently is to accommodate fast-moving consumer electronics technology into the regulated medical device cycle.
Absolutely.
That's a brilliant challenge.
Yeah, very much.
Everyone answer? Okay, sorry, I didn't want to interrupt. So I want to thank everyone on this session. That was fantastic. And be sticky.